Well, as we get older, we tend to need more medication, so it's not unusual for seniors to juggle several prescription drugs for different health conditions. But that can be risky for many reasons. The Fox Medical Team's Beth Galvin has some advice for seniors.
As we get older, our bodies may not tolerate certain medications as well as they used to, and the more drugs that we're taking, the higher the risk of a dangerous drug interaction or a negative side effect. So we asked a Grady physician who works with older patients what seniors can do to protect themselves.
We'll move to the next patient.
Grady geriatrician Ugochi Ohuabunwa and her team are making the rounds, discussing each patient in their care. And there's one she's concerned about.
She fell and became more confused as a result of the medication she had been exposed to.
Dr. Ohuabunwa, an associate professor of medicine at Emory University, takes care of patients who are usually 75 and older, or some who are younger with ongoing health issues. And many of these folks, she says, are juggling multiple prescription drugs.
Sometimes maybe about 8 medications, sometimes 10, sometimes fewer, depending on the patient.
So the Grady staff reviews each medication an older patient is taking, knowing that they can interact with each other and cause negative side effects. And Dr. Ohuabunwa says an 80-year-old can't tolerate medication like a 40-year-old.
On the other hand, it's a challenge because they have multiple medical problems. They have high blood pressure, for which they are treated on 3 or 4 medicines, and then they have heart failure, and they're on multiple medicines for that also.
Another challenge?
It's a huge problem.
Hospitals may not share the same electronic medical record system, so when a new patient transfers in, the staff may not know and can't check what he or she is taking. But there are 3 simple ways you can lower your risk of a medication mistake.
And so it's really very important that patients are aware of what medications they are taking.
So make a list. Write down the name of each drug you take, why you take it, and the dosage. Then go over your meds with your doctor and make sure they're current.
And so a number of times a medication may have been prescribed months or years ago, and we just continue with those medicines, and some of those medicines are harmful.
If you're prescribed a new medication, ask about possible drug interactions and side effects. Because Dr. Ohuabunwa says being an empowered patient might just keep you out of the hospital and at home where you need to be. Ask your doctor or your pharmacist to review the list of medications that you're taking, and tell the doctor about any over-the-counter medications or herbal supplements that you're taking, because those too can cause drug interactions and side effects. For the Fox Medical Team, I'm Beth Galvin.
Chief